the social action projects of the YnD democracy, the fellowship, it was mainly aimed at giving us a hands-on experience of working in the social reality and which is faced by the individuals and the communities in daily life. The various sessions held by Rajesh sir and Nikita ma'am helped us a lot to learn about how to interact socially with the communities and making our projects participatory, and also telling us about the various social issues that we observe. For example, issues related to gender, how citizen participation is important in everything, and how to empower the civil society as its own. Also, we learned about how decentralized community governance is important for every issue. So, being from a medical background and seeing issues related to drug abuse in everyday life, for example, recently also in latest news, we saw that people from influential families were also involved in drug abuse. So, I took the topic of drug abuse and management and conducted a survey and various group discussions with university students and people in the society. So I'll just share my screen. So is my screen visible?
Yes, but not the presentation or whatever you wanted to share. Yes, it's visible now. It's perfect.
Okay. Yeah. So the first International Day Against Drug Abuse was first observed on 29th June 1987, way back by the United Nations itself. And since then, various strategies have been adopted with global cooperation to eradicate the malpractice of drug abuse from the society. However, the ground reality is quite different in countries like India because the local information is not available about what happens in the ground reality. So, considering the trend of drug abuse, it is important, it is necessary to gather information locally and then manage this problem by taking biased decisions. So, I conducted a group discussion with the students of the university, which was aimed at the issue of drug abuse in the society and our everyday lives. So, the various factors that we discussed were how the history of abuse among the family members and the relations affected the tendencies of people to indulge in drugs, and how the social media played an important influence on the drug abuse. There were other factors like stress and peer pressure, how friends influence us to get into the malpractice of drug abuse, and how people want to fit into the society and thus get into drugs. So we also made an action plan among ourselves on how to resolve these problems. And the main part of this plan was that there should be one-on-one counseling sessions by the sensitized peers, because when we indulge with our peers, we open ourselves more easily, and talking with them, indulging with them about our problems helps us to remedy these problems. I also conducted a survey among the various people in the society, which included students from the universities and also teachers which are studying in the government schools and the private sectors. So the survey was conducted with the aim to know the ground reality about what people think about the topic and what they observe in order to make it participatory. So that survey tested the knowledge of the people about the topic, and I observed that many of the people didn't know about the various complications of drug abuse in everyday life. And so I told them to get to know more themselves, that they should research about the topic and get to know what are the various complications that affects them. So the most important factors that cause a tendency towards drug abuse were teenagers' curiosity, about how teenagers are always curious about to try new things, and that is why they indulge in the malpractice. And the various other factors were joy seeking, somatic diseases, peer pressure, psychiatric disorders, and the lack of knowledge. Because people don't know about how the drug abuse can affect their everyday lives, and their personal life also gets affected. I also conducted a one-on-one session, I talked to a few of my students in my university, and one of them also came out and said that he was addicted to drugs and he had a smoking and an alcohol problem. So when I asked him about how he overcame it, it was only because he had got awareness. So since he had gained awareness, he had attended a lot of counseling sessions, and from those sessions he got to know about how the uh, smoking and the alcohol problem was affecting his everyday life, and thus he overcame that problem. And after indulging with me, he thought that he could explain himself more properly. So spreading awareness is one of the most important part of the action plan in order to eradicate drug abuse from the society. Thank you.
Thank you, Kabil. Do you want to just briefly share about your experiences in general with the fellowship program? Kabil, you're on mute.
Yes,
You can
it
quickly
was
share.
a
Yeah.
yeah, it was a very good experience because we got to learn a lot about how to interact with others and what are the various important parts about conducting an action plan, because we got to know about the various stakeholders that are present in the society, about what are the various contributions with the stakeholders and how each problem needs to remedy itself.